my name is Meredith Allen, and I'm a student physical therapist assistant at Jeff State, and today I want to talk to you about osteomyelitis. Osteomyelitis is a bone infection. It's an inflammatory bone infection that's caused by bacteria such as fungi, mycobacteria, or staphylococcus. It affects bones and surrounding structures. It can be acute, which is typically what you see in pediatric cases, or it can be chronic, which is what you typically see more in adult cases. Typically, it's caused by a bacteria called staphylococcus, or also known as just staph infections, but it can be caused by other things, like I said earlier. Most commonly in pediatric cases, it's caused by MRSA, and it can require surgical intervention, including amputation in worst case scenarios. Some symptoms are redness, tenderness, nausea, chills, a fever, inflammation, joint and back pain, and swelling. And I say joint and back pain, but it depends on where the infection is. So if it's in the hip joint, you'll have pain there. A lot of times low back pain can be what people think that it is. Low back pain is actually osteomyelitis setting in the vertebrae. So it depends on where the infection is where the pain is going to present. So who's affected by osteomyelitis and what are the risk factors? So smokers are highly affected. Diabetics, especially in their feet if they have neuropathy, it typically can set in wounds in diabetic feet because people don't know, they can't feel the wounds gathering, and then there's bacteria that builds up in there which causes this osteomyelitis. It happens in immune-compromised individuals, people who abuse alcohol or IV drugs. Recent injuries, even simple ones like the case I'm going to tell you about in just a couple minutes, happen with just a little bitty scratch on the knee from falling down. And recent orthopedic surgeries, the bacteria can adhere to surgically implanted devices. So if you have somebody with a knee replacement, hip replacement, the bacteria can adhere to that and it makes it more resistant to antibiotics. It's more common in males and more common in the ages between 2 and 12 years old. Physical therapy intervention, so what can we do? Screening, so we can educate people on post-op conditions, so knowing what is an abnormal incision, what's a normal one, so that there's no pus coming from incisions, redness, warmth, any of those things. And I know that's so general, we tell people about DVTs and everything else, but it's so important that we pay attention to incisions because we may be the only one that sees them after their surgery. Wound care post-operatively, so making sure that their incision looks good, telling them how to take care of their incisions. Prevention typically occurs with fractures in adults, so this is where that sets in. A lot of times an adult will have a fracture, a stress fracture, and this bacteria will get in that fracture and cause the bone to have this osteomyelitis. So education on fall prevention, proper treatment of fractures, making sure that people are healed when they're in our care is very important. And post-op after osteomyelitis, so if someone has an amputation or a surgery we'll talk about in just a minute, it's our job to help them with range of motion, proprioception, amputation education. So if it's transtibial, making sure that we know there's no flexion contractures or anything that sort, so just our typical amputation education that we do. And strength, a lot of times these people will get orders for physical therapy when they've just been laying in bed for weeks and weeks trying to heal this, so it's our job to get them back strong enough to be able to get back to the best level of function that they can get to. So what are some medical interventions? Diagnostics, it's hard to diagnose because it's got such common side effects of surgical interventions, inflammation, redness. You see that, so people will do blood work, especially if they see pus. They'll do blood work, and then they can also do an MRI or a bone scan to see the severity if the blood work comes back showing that there is an infection. Medication, so you have IV antibiotics. Vancomycin is typically what's used to fight MRSA in pediatric cases, but it's hard to get the correct dosage, and so it takes a little while to make sure that that's working to fight the infection but not harm the body because it's a very strong antibiotic. Usually you'll get 4 to 6 weeks of IV antibiotics, and then once discharged you'll still probably be on oral antibiotics for anywhere from 2 to 8 weeks after discharge. So some surgical interventions are draining. They may have to go in and remove the dead tissue, restoring blood flow that may be caught off guard, like the blood flow may be impaired due to necrotizing or necrotic tissue, and then potentially amputation if there's no way to save the bone or extremity. So diagnoses that can resemble osteomyelitis, it's very important that we know these. Ewing sarcoma or osteosarcoma, so your bone cancers, reactive bone marrow edema, traumatic or stress fractures, inflammatory arthritis, and gout. So things like this we see every day. People with arthritis, we see people who we may think they have gout, but it's very important that we recognize the signs and symptoms and always send them back to the doctor if we're unsure of what they could be presenting with. It's always better to be safe than sorry. So why do I care so much about osteomyelitis? So not only have I seen a couple cases in my acute care observation, but this little boy right here, his name is Luke. He's my husband's little cousin. He actually fell and scraped his knee when we were all hanging out at the beach, and came back home. Nobody even thought anything about his little scrape on the knee. He was fine. And he kept telling us that he didn't feel good. He felt sick to his stomach. They took him to the doctor. He had a high fever, chills. I mean, he was miserable, and they couldn't quite figure out what it was. So they ran a bunch of tests, did some blood work, and found out that he had an infection. And actually, he had developed staph in that little cut, and it got into his arm. It's crazy how it went through his bloodstream and got into his arm. And it was a scary time in our lives. We were scared that he may lose his arm. We didn't know how bad this was going to be, and thankfully they were able to get the IV antibiotics going, the right dosage figured out. Some great doctors at Children's helped him, and you can see here this is all of us in contact precautions, so that we were making sure we were careful, and it took a little while before we could even go and visit him. But it's super important because it happens especially in pediatric cases, and to see that sweet little baby so sick really touched my heart. And I just want to make sure that we bring awareness to that, especially since it happens so commonly in post-operative patients, and we see that a lot with knee replacements, hip replacements. So it's important that we're paying attention to our patients, paying attention to their incisions and their symptoms, and always taking them seriously. And if we're not sure, making sure we send them back to the doctor, because we may be that person that needs to intervene to make sure that nothing serious happens to our patients. Thank you for watching. Here's my reference and where I got some information from. And I hope that you've learned something about osteomyelitis. Thanks.